Have you ever solved a dosage calculation question and felt confident about it? Like, okay, I finally get it. I think I understand the concept. But then you see another question that is worded differently, you're being asked something else, and now you're not so sure anymore. If that sounds like you, stick around. In today's video, I'm going to show you my foolproof blueprint that will help you instantly recognize what the dosage calculation is really testing. So no matter how the question is worded, you'll get it right every single time. By the way, I'm Dr. Jess. I'm a pharmacist and I make pharmacology and calculations simple so you can finally feel confident, not confused when you study or take your exams. Now, the main reason why students struggle with liquid dosage calculations is because they can't really tell what the question is testing. Once you learn to identify that, liquid dosage calculations can be quite easy. Now, let's look at the blueprint. So, for liquid dosage calculations, usually you'll have the medication. So, for example, amoxicillin, and they'll give you the concentration. So, in this example, 400 milligram per 5 ml. And then you'll be given the dose. The dose could be given in ml, teaspoon, tablespoon, milligram, and more. Now, my blueprint on the left-hand side, it tells you when the concentration is not needed. That means you don't need to use it at all to find your answer. And then on the right-hand side is when you need to use the concentration to find your answer. First, I'm going to explain the concept, and then we're going to apply these concepts with real examples so you can actually see and understand what I'm saying. So let's go over it first. So when is the concentration not needed? So if the dose is in ml and the dose is given in ml and they're asking you to find the dose in ml, in this case, you don't need to use the concentration. They're just testing your SIG code knowledge. If the dose is given in milligram and you're asked for the dose in milligram, again, this is testing SIG code knowledge. You don't need to use the concentration. Finally, if the dose is given in another unit of measurement like teaspoon, tablespoon, and ounce, and you are asked for the dose in ml, this is testing unit conversion. And don't worry, if you're feeling confused right now, don't you worry. I'm going to give you an example for each scenario so it makes sense. Now, let's look at the right-hand side. When is the concentration needed? If the dose is given in milligram and you are asked to calculate the dose in ml, and then I'll show you through my example how to do that. The second scenario, if the dose is given in ml in the problem and you are asked to calculate the dose in milligram, you'll need to use the concentration for that. And then lastly, if the dose is given in another unit of measurement like teaspoon, tablespoon, or ounce, and you are asked to calculate the dose in milligram, you'll need to use the concentration. Now, let's apply what we just learned. Okay, so when you do not need the concentration at all to solve the problem. So the first scenario that we talked about is when the dose is given in ml and you are asked to calculate for the dose in ml again, the daily dose in ml. So let's look at the example. You have amoxicillin 400 milligram per 5 ml, 10 ml PO Q8 hours, calculate ml per day. So here we can see that the dose is given in ml. It's 10 ml. What is being asked is also ml. Okay, so same unit. So here you don't need the concentration at all. All this is testing is your SIG code knowledge. Do you understand what PO means? Do you understand what Q8H means? So it means every 8 hours. So that means three times a day. So 10 times 3, that's 30 ml per day. That's the total daily dose in ml. So see, in this scenario, we did not use the concentration at all. The concentration is 400 milligram per 5 ml. So understanding what the problem is testing, because the reason why I'm saying that, I get asked this a lot by students, and sometimes they get nervous if they see a number in the problem but then they don't use it. They're thinking, okay, they wouldn't give it to me if I don't need to use it. But if you are confident, you understand what is being asked, what is being tested, then you won't second guess yourself. Okay. Now, let's look at the second scenario where you don't need to use the concentration at all to find the answer. So, amoxicillin 400 milligram per 5 ml, but now the dose is given in milligram, 800 milligram every 8 hours. Calculate milligram per day. So this scenario, the dose is given in milligram and you are asked for the daily dose again in milligram. All this is testing, just like scenario one, is SIG code knowledge, milligram to milligram. So all you have to do, every 8 hours, that's 3 doses per day. So 800 times 3, that's 2400 milligram per day. Now, this is the third scenario, the last scenario where you don't need to use the concentration to find the answer. So if the dose is given in a different unit of measurement, so I give some example here, so either teaspoon, tablespoon, ounce, it could be something else, and you are asked to find the dose in ml. So this is testing unit conversion knowledge. So let's look at the example. You have amoxicillin 400 milligram per 5 ml, 2 teaspoons every 8 hours. Calculate ml per day. So the dose is given in teaspoon and you are asked to calculate in ml. So here we don't need the concentration. All you need to do here is a unit conversion. You're converting teaspoon to ml. So once you know that unit conversion factor, 1 teaspoon is 5 ml, then you'll know that 2 teaspoons is 10 ml. So to calculate ml per day, it'll be 10 times 3, that's 30 ml per day. Okay, so we just looked at the three scenarios where you do not need to use the concentration to find the answer. Now, let's look at the three scenarios where you're going to need the concentration to find the answer. So scenario number one is when the dose is given in milligram and you are asked to calculate the dose in ml. So in this case, you can use dimensional analysis, you can use ratio and proportion to pretty much convert from milligram to ml. So let's look at the example. Amoxicillin 400 milligram per 5 ml, 800 milligram every 8 hours. Calculate ml per day. So as we can see, the dose is given in milligram and then we're asked for the daily dose in ml. So let's use dimensional analysis. Again, like I mentioned, you can use dimensional analysis, you can use ratio and proportion. Now, if you want to learn more about dimensional analysis, I have a video on dimensional analysis in my channel, so check it out. So you'll set it up, so you'll have 5 ml over 400 milligram times 800 milligram. So milligram cancel out, so you have 10 ml. So 10 times 3, because it's 3 doses per day, so that's 30 ml per day. So in this scenario, for milligram to ml, you needed to use the concentration. Use dimensional analysis or ratio and proportion to find the answer. This is the second scenario where you would need the concentration to find the answer. So if the dose is given in ml and you are asked to calculate for the dose in milligram. So here again, you can use dimensional analysis, ratio and proportion to find the answer. So let's look at the example. So amoxicillin 400 milligram per 5 ml, the dose 10 ml every 8 hours, calculate milligram per day. So we have the dose in ml, we are asked to calculate daily dose in milligram. So the last scenario, we use dimensional analysis. In this scenario, let's use ratio and proportion. So you can see both methods. And also, I do have a video on ratio and proportion on my channel. If you want more information about that, check it out. So for ratio and proportion, we'll have 400 milligram over 5 ml equals x over 10 ml. Then x equals 400 times 10 divided by 5, that's 800 milligram. Then it's 3 doses per day, so we'll multiply by 3, and that's 2400 milligram per day. And this is the last scenario, so where you would need the concentration. So if the dose is given in a different unit of measurement, like teaspoon, tablespoon, ounces, and then you're asked to calculate for the dose in milligram. In this case, you'll need 2 steps. The first step is a unit conversion to milliliters, and then you can use dimensional analysis or ratio and proportion to convert that ml to milligram. So let's look at the example. So we have amoxicillin 400 milligram per 5 ml, 2 teaspoons by mouth every 8 hours. Calculate milligram per day. So the dose is given in teaspoon, and you're asked to calculate the daily dose in milligram. So like I mentioned here, 2 steps. So we need to convert teaspoons to ml. So 2 teaspoons is 10 ml. So then once we have the dose, we can convert that dose from ml to milligram by using either ratio and proportion or dimensional analysis. So in this example here, we're using ratio and proportion. So we have 400 milligram over 5 ml equals X over 10 ml. So X then equals 800 milligram. So it's 3 doses per day. So 800 times 3, so that's 2400 milligram per day. So any liquid dosage calculations that you're solving will fall into one of these categories. So once you understand the concept, you understand when the concentration is needed, when the concentration is not needed, what is being tested, then you'll feel confident about your answer, and that will ensure that you get it right every single time. Now you have the blueprint. Identify what the question is testing, decide if you need the concentration or not, then solve with confidence. If you found this video helpful, then I would definitely recommend that you get my calculation workbooks. I have one workbook specifically on liquid dosage calculation. Check it out, link in the description. And don't forget to like the video, subscribe to the channel, and turn on your notification bell. I'll see you in the next one. Bye.